Detroit, Michigan, home of the U.S. auto industry. A virtual ghost town under a stay-at-home order issued by the state of Michigan aimed at slowing the COVID-19 disease. In Michigan, 50,000 people have been infected with the coronavirus, and as many as 5,000 people killed by COVID-19 between March and May of 2020, the vast majority of them around Detroit. Across the United States, the death toll from COVID-19 is projected to be more than 150,000.
Any vaccine.
The U.S. administration's top virus expert, Dr. Anthony Fauci, has called for a new vaccine to combat the virus.
We would have a vaccine that would be able to protect the American people.
So this is urgent.
And Microsoft founder Bill Gates says he's spending billions of dollars for vaccine research so that people the world over can eventually be vaccinated.
It's going to have to go to 7 billion people. That's how we're going to end this pandemic.
Gates suggesting a COVID-19 vaccine should be mandatory for everyone worldwide.
You don't have a choice. People act like you have a choice.
However, Gates has not asked Connie Johnson of Detroit, Michigan, what she thinks.
And I have news for Bill Gates. He is not my doctor. I don't take my marching orders from Bill Gates or the Gates Foundation.
Connie Johnson represents the nonprofit Michigan for Vaccine Choice, made up of 20,000 parents across Michigan, many of whom say their children suffer from medical disorders such as autism as a result of being vaccinated. Many parents say they are not in agreement with current recommended requirements for vaccines in individual states from the CDC, the Centers for Disease Control and Prevention in the U.S., which recommends that individual states by law require children age 4 or older and who are entering kindergarten, pre-kindergarten, or daycare to have proof that they have received booster doses of the following: polio virus vaccine, 2 doses of measles, mumps, rubella vaccine, known as the MMR vaccine, 3 doses of hepatitis vaccine, 2 doses of chickenpox vaccine, a booster dose of diphtheria, tetanus, and pertussis vaccine known as the DTaP. While enforcement of vaccines varies widely among states, children who have not received all required vaccinations or valid exemption may be prohibited from attending school. In many cases, parents against vaccines are allowed to file vaccine exemption forms like this one, stating that their religious beliefs make them uncomfortable with vaccines. Medical exemptions are also allowed, but are becoming increasingly more difficult to obtain in many states. Connie Johnson says her child was harmed by a DTaP vaccine.
My oldest son had seizures after his first DTaP. It was horrifying. I blamed myself because I thought it was something that I did. And it was something that I did. I vaccinated my child, but I trusted the medical system, and the medical system failed me by not being forthright with me. That's a loss of trust that will never be brought back.
Health experts with the United Nations, the World Health Organization, and the CDC routinely remind the public that vaccines have saved millions of lives around the globe. The question is, how many vaccines are needed today? For example, 100 years ago, children received just 1 vaccine to prevent smallpox. Today, children are receiving vaccines to prevent at least 16 different diseases. Many children receiving as many as 26 vaccination shots, as many as 4 to 5 inoculations at a time. And now a potential vaccine for COVID-19 may soon be added to a long list of vaccines.
This is ridiculous.
A trio of veteran physicians in Detroit who together say they have more than 20,000 patients provide a second opinion about a potential vaccine for COVID-19.
I don't get it. I know people die from this. I don't want to discount anybody who has suffered or died from COVID. I know it's horrible when people get really sick from this. But at the end of the day, how is this any different than a bad flu season? It's not even necessarily a bad flu season, it's just a flu season.
Increasing numbers of physicians across the United States are questioning whether the number of COVID-19 deaths are in fact COVID-19 deaths, and whether they may have been inflated, because they say many victims were already terminally ill with other illnesses such as cancer, before being infected with the coronavirus.
And then you also were found to have COVID, that would be counted as a COVID death.
In fact, the director of public health in the U.S. state of Illinois recently confirmed that many patients near death with terminal illness before being infected with the coronavirus were ultimately counted as COVID-19 deaths.
It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death.
If you die of anything and you have COVID, it's a COVID death. So if you die of a heart attack, but you happen to be positive for COVID, it's a COVID death.
If that's the case, some doctors say the actual death toll of COVID-19 in the U.S. may in the end be no greater than those who die from the flu every year.
Why do we not shut down the world for the flu? Now we have a vaccine for the flu. Half the people don't take it, and it doesn't work all that well, particularly in the elderly and all these people that need a vaccine to protect them. And so now we're going to come up with this COVID vaccine. They've been working on this for 20 years. We know they've had some really bad starts with some of the earlier coronaviruses, like SARS-1, that when they vaccinated mice, they all developed antibodies, and that's all they're going to test on these patients they're doing. They all developed antibodies, but when they exposed these mice to the COVID virus, they died more frequently than the ones that were never vaccinated.
The mortality rate of COVID-19, according to the World Health Organization and the CDC, may be higher in underdeveloped regions of the world where people do not have access to clean water or sanitation or soap, or who don't have a house or apartment to stay home in, and where social distancing can be difficult. And the mortality rate may be lower in regions with warmer weather, where citizens receive more vitamin D from the sun. That helps strengthen their immune systems. Many physicians say a vaccine may not be necessary for COVID-19, particularly in the United States, if more citizens in the U.S. simply strengthen their immune systems by exercising more and by changing their diets from what is nationally a pretty unhealthy one, with a lot of fatty foods and too many sugary beverages. Changing their diets to foods with more vitamins they need to build a strong immune system, like vitamin C.
We're designed to have vitamin C on board.
Dr. Rick Ng and his colleagues are conventional doctors with holistic principles who say they encourage their patients to load up on vitamins to strengthen their immune systems, to prevent and fight off disease, what they call preventative medicine. Unlike conventional medicine, they say, in which doctors treat diseases or pathologies after the fact by using drugs, radiation, and surgery. Dr. Ng says of the hundreds of patients they've tested here for COVID-19, only 20 of them have tested positive, and that none have been hospitalized.
Our patients, between the couple of practices that we have, what have we got? 20, 30,000 patients? None of them ended up in the hospital. That's pretty profound. And so just take a look at that. The strength of the body terrain.
Dr. Ng says chances are that people here in Detroit, the Motor City, who are suffering from COVID-19, most probably had weak immune systems to begin with.
The analogy that I use in regards to how medicine is being practiced right now, it's analogous to the auto industry saying, do no maintenance on your vehicle. And when you blow your engine, we'll give you chemotherapy, bypass surgery, hip replacement. That's why we're going broke as a nation. We're designed very well, and my job is to, as quickly as I can, understand your physiology and hand you the owner's manual so I can empower you, so you're not going to go and die from COVID.
While the World Health Organization and the CDC continue to encourage all children to be vaccinated, many parents question just how natural it is for a child to be receiving so many shots.
And a lot of that is in the first 6 months of life. That's a lot of medications to give a teeny tiny little body. I mean, when's the last time you as an adult went into the doctor's office and received 6 to 8 medications or shots for something at the same time? I absolutely trust parents. Parents know their children. I know what I saw as a parent There's nobody on this earth that knows my child better than I do.
Johnson says she and thousands of other parents like her she hears from across the United States have been ridiculed and demonized as so-called anti-vaxxers by the mainstream media and through social media for daring, she says, to question laws she says are essentially forcing parents to vaccinate their kids. She says many parents who are pro-vaccine are unfairly accusing any parents who are not of endangering other people's kids from contagious diseases in society.
People can be really, really unkind, especially on social media. They are name calling. If it comes to the vaccine issue, you don't deserve to be a parent. I hope your kids die. I've had people threaten my life on social media before.
I would agree that it absolutely has been demonized, that anybody who is anti-vaccine is jeopardizing my kid and,
Johnson says all parents are welcome to join Michigan for vaccine choice, including those who agree with vaccine schedules mandated by the CDC here in the United States.
It's vaccine choice, so we have the gambit of people. We have people that have fully vaccinated according to the CDC schedule. We have people that have chosen not to get, for example, the flu vaccine. We have people like myself that had discussions with their doctors and decided not to stick to the CDC schedule but wanted to vaccinate some. And then we have people that choose not to vaccinate at all. And we support whatever the choices of the family that is appropriate for their family.
And what do you hear from people that say, well, you guys should be for vaccine because you're putting people's lives at risk if you don't? I'm sure, do you hear that?
Oh, we hear that all the time. And the biggest comeback for that is, if your child is fully vaccinated, what have you to worry about? That's why you get vaccinated, is to protect you against vaccines. Suddenly, your vaccine isn't going to work because my child is either under or unvaccinated. That is not how it works. We have certain inalienable rights, and one of them is our bodily autonomy. We absolutely have the right to choose what goes into our body. We absolutely have the right to true informed consent, which means that it is a true risk versus benefit. We don't have that right now.
Johnson says what is particularly concerning to her is the National Childhood Vaccine Injury Act of 1986 that makes it all but impossible for vaccine manufacturers to be sued if their vaccines are proven to cause injury, exempting them from any financial liability.
There's no liability for a product that is being mandated.
However, while vaccine manufacturers may not be sued, the U.S. government does offer to compensate people who've claimed to have been injured by vaccines through a program called the National Vaccine Injury Compensation Program, also known as the Vaccine Court. One such vaccine injury victim is U.S. citizen Angelica Black. The court ruling that Angelica suffered a severe brain injury when she was given several vaccine shots at just 3 months of age, leaving her in this state ever since. Her family was awarded $2 million and $250,000 a year for medical expenses for the rest of her life. In the last 30 years, there have been almost 22,000 vaccine injury claims filed, in which the U.S. government has paid out more than $4 billion in compensation for vaccine injuries, a sum of money that vaccine critics say proves vaccines are not always safe. However, vaccine supporters like Bill Gates say the benefits of saving millions of lives outweighs the risks of vaccine injuries, and that with COVID-19, a vaccine is necessary.
For the world at large, normalcy only returns when we've largely vaccinated the entire global population.
People are getting sick.
Robert F. Kennedy Jr., nephew of John F. Kennedy and a noted environmentalist in the United States, has joined the growing movement of citizens in this country questioning what he says are untold thousands of children around the world whose illnesses or deaths, he says, may be linked to vaccines. Kennedy claiming scientific studies supporting the benefits of vaccines lack credibility because the effects of vaccinations on children who've been vaccinated are not sufficiently compared to children who've not been vaccinated. Unvaccinated children, the Kennedy says, do not suffer from the same side effects vaccinated children do. He says current scientific studies on vaccines are woefully short of proof that vaccines are safe.
This isn't science. This is insane.
There's so many vaccines that children are receiving now, and even adults. And I think people are recognizing that these vaccines can cause injury, and you're having an increasing group of people that either they've been injured by a vaccine or their children have been injured by a vaccine. And that has created this whole concern about how many of these things do we need, and do we really need vaccines at all? Is the entire idea behind vaccination valid? In medicine, we're always looking for the idea of risk and benefit of any procedure. The trouble with vaccines is we're told that these are wonderful things that do wonderful things for our children, protect our health, but yet we don't really know what those risks are. We are told there are none, and yet people have begun to recognize that there are risks because they're seeing it themselves.
Dr. James Neuenschwander says what may be panicking the public about COVID-19 are seemingly endless comparisons in the media, he says, to the Spanish flu epidemic over a century ago. The Spanish flu claimed 50 million lives around the world. By comparison, less than 500,000 people around the world have died from COVID-19 as of May 2020. He says there's far too much fear and gloom and overkill, he says, in the news media and social media about just how dangerous COVID-19 truly is.
People want to compare this to the Spanish flu. 50 million people died of the Spanish flu out of a world population of maybe 1 billion at the time. That's 5% of the entire world died of that flu. Why is this going on? It's madness. But that's just my opinion.
However, the World Health Organization and the CDC maintain that a COVID-19 vaccine is necessary to create antibodies that will ultimately help the world population fight off the disease.
You may have antibodies, but it's not doing jack.
But you don't get immunity yet.
You don't get immunity. Just because you have antibodies does not infer immunity to you, especially when you're so low in the things that drive your immune system. Vitamin C, vitamin A, vitamin D. We take a very humble approach to the practice of medicine. We honor what we do. We took an oath to take care of people, not to march in lockstep and be popular.
The vaccine that prevents you from getting COVID-19.
Those like Bill Gates who support vaccines argue that vaccines are urgently needed, particularly in impoverished regions of the world where people who cannot help themselves need help the most to be saved from disease. Others, however, like Connie Johnson, maintain there are alternative, healthier measures than mandating vaccines around the globe.
I think that he's painting a beautiful picture of philanthropy, which on the surface is really great. Who doesn't want to save the world? But if you want to save the world, why don't you provide them with really nutritious food and clean water? Why does it have to be through vaccines?